So diarrhea occurs in about 16 to 18% of the patients on apremilast, and it's about 3 times greater the rates than that seen in the placebo group. Typically, when diarrhea were to occur, it usually occurs during the first 2 weeks of therapy, and the duration of the diarrhea is usually about 2 weeks. In most cases, diarrhea can be managed while on apremilast and is not a reason for discontinuing the medication. And some of you may wonder, gosh, what is the mechanism of this apremilast related diarrhea? It's a type of secretory diarrhea, and it's thought to be really a class wide effect for our PDE4 inhibitors. And the proposed mechanism is that apremilast can increase, as we know, the intracellular cyclic AMP level. As a result of that, that can lead to extra activation of the chloride channels in the crypts of the small intestine. So what happens is that there will be an excess secretion of these chloride ions, which lead to this secretory diarrhea. And it can take the large bowel really a couple of weeks to really adapt and then adjust. Now, how do we manage this? Typically, with over the counter therapies include things like Pepto Bismol or fiber supplements. Those are typically sufficient for most patients. Sometimes you may need to resort to some prescription medications. Oftentimes, the oral prescription agent, crofelemer, can be very helpful in terms of reducing the secretory diarrhea. One can also use Lamodal as another option for our patients. So again, the apremilast associated diarrhea can occur in about 16 to 18% of patients, typically mild. It can be managed without discontinuing apremilast through these methods.